Hi, we're going to take a look at the prostate cancer fact sheet from the American Cancer Society. Let's learn a little bit about prostate cancer. Keep yourself healthy for yourself, your family, your friends, and your world. So let's learn from the prostate cancer fact sheet provided by the American Cancer Society. Prostate cancer can start in any area of the prostate. The prostate is a gland found only in males. It's a guy thing. In the U.S., prostate cancer is the most common type of cancer in men. I didn't know that, other than skin cancer, which is very common. And the second leading cause of cancer death after lung cancer. This is some pretty serious stuff. So, what are the risk factors? The risk factors are age. Men of any age can get prostate cancer, but the risk of having it is higher after 50. We'll go to after 50. After 50. The races and ethnicity are factors. The risk of getting prostate cancer is higher in African American men and in Caribbean men of African ancestry than in men of most other races. Family history is very important, right? Men who have a close relative, a father or a brother, who has had prostate cancer are at a higher risk of developing the disease themselves. The risk is higher for men who have had a brother with the disease than for those who have a father with it. Interesting, huh? Having more than one close relative who has had the disease increases the risk even more, so that the probability is there. So you want to get checked out. You want to take care of yourself, especially if the relatives were young when the cancer was found. Another one is inheriting gene changes. Certain gene changes, most commonly, and I'm just going to read these, BRCA1 and BRCA2 genes. Don't often see that in the news. Or having Lynch syndrome, LYNCH syndrome, can increase a man's risk of getting prostate cancer. And finally, diet. Men who eat a lot of red meat or high-fat foods may have a higher risk of getting prostate cancer. There's a lot of reasons for that, but so how can we prevent it? How can it be prevented? Let's see what the American Cancer Society recommends about preventing prostate cancer. There's no sure way to prevent prostate cancer. Well, that's a drag. And some risk factors can't be changed, such as age, race, and family history of the disease. But, yeah, there we go. There are some things that might help lower the risk. Regular physical activity, staying healthy, staying at a healthy weight, right? And eating a diet high in vegetables and low in fat might help lower the risk of prostate cancer. So keeping active and eating more veggies, good stuff. Screening and early detection are very important. Screening is testing for cancer in people who have no symptoms. At this time, it's not clear if the benefits of prostate cancer screening outweigh the risks for most men. There's different ways to do it. The American Cancer Society recommends that men have a chance to make an informed decision with their healthcare provider about whether to be screened for prostate cancer. The decision should be made after getting information about the risks and potential benefits of prostate cancer screening. Men should not be screened unless they've received that particular information. Now, the discussion about screening should take place. You should be hearing this stuff at age 50 for men who are at average risk and are expected to live at least 10 more years. Age 45 for men at high risk, including African American men, Caribbean men of African ancestry, and men who have a first-degree relative, father or brother, diagnosed with prostate cancer at an early age, which would be younger than 65. Age 40 for men at even higher risk, including those with more than one first-degree relative who had prostate cancer at an early age. So about this, after this discussion, men who decide to get screened should be tested with the prostate-specific antigen. It's a PSA. Blood test. Some doctors might do a digital rectal exam, also known as a DRE, as a part of the screening. How often a man is tested will depend on their PSA level, general health preferences, and values. Let's take a look now at some signs and symptoms of prostate cancer. Early stage prostate cancer usually has no symptoms. More advanced prostate cancer, which is cancer that may have spread outside the prostate, may cause symptoms such as problems urinating, such as pain or burning during urination, or the need to urinate more often, especially at night. Blood in the urine or semen, trouble getting an erection, weakness or numbness in the legs or feet, or not being able to control the bladder or bowel caused by cancer pressing on the spinal cord, pain in the hips, spine, ribs, or other areas caused by cancer that has spread to the bones. What is the treatment? Treatment for prostate cancer depends on the type and stage of the cancer, results from special testing that might be done on the tumor, as well as the person's age, other health problems, and personal choices. Men who are diagnosed with prostate cancer should discuss all treatment options and make informed treatment decisions together with their doctors. living with prostate cancer. From the time a person is diagnosed with prostate cancer, their quality of life is affected in some way. Different physical, social, psychological, spiritual, and financial issues can come up at any time during the cancer experience and after treatment is over. Some types of prostate cancer can be serious. Palliative care is focused on helping to improve the quality of life and dealing with issues that people living with a serious illness might have. People with advanced prostate cancer may benefit from having palliative care at any time from the point of diagnosis throughout treatment and beyond. Good communication between a person with cancer and their healthcare team is important and involves asking and answering questions, working together to set care goals, making shared decisions, managing side effects and other issues, making sure to schedule up follow-up tests and care. So to learn more, go to cancer.org/prostate cancer. Cancer.org/prostate cancer. Also, you'll be able to find out all about all sorts of other cancer there at the American Cancer Society. Thank you very much for listening to this chat about prostate cancer.